Hello everyone, my name is Maharlika Diarse. I'm going to be doing intramuscular injection administration. Before I start, I have my Nightingale scrub top, Nightingale scrub bottom, Nightingale badge. My hair is tied back. There's nothing on my nails, no acrylic nails, no hanging jewelry. I have Miss Smith here, her deltoid. I have a 3 milliliter syringe. And I have a 25 gauge 1-inch needle. And I have my dosage calculation. There's nothing on the back. I have gloves, alcohol swabs, my morphine sulfate, gauze. Alrighty. Before I start, I am going to verify the 6 rights: right patient, right drug, right dose, right time, right route, right documentation. Alrighty. So now I'm going to check the EHR, MAR to see what did the doctor, what did the provider ordered. So he ordered 6 milligrams morphine sulfate IM by 1 dose. Alrighty, so now what is available? We only have 4 milligrams of morphine sulfate. So I did my dosage calculation, and the dosage calculation is milliliter over 4 mg equals 6 mg, which was ordered over 1, and it is 1.5 ml. Alrighty, so now that we got that over with, put it aside. So now I am going to grab all my supplies, walk to the patient's room, knock on the door, provide the privacy curtain, place these on a clean flat surface, and I'm going to wash my hands. Hello, Miss Smith. My name is Maharlika. I'm going to be your nurse today. Can you please provide me your name and date of birth, please? So I'm going to check this as a verification. I'm going to check her wristband. Her name and date of birth correlates with the EHR. Right, perfect. So now my purpose is to give you intramuscular injection to whatever site you want on your body, and your provider has ordered you morphine sulfate. So this medication binds to your central nervous system, and the bioreceptors alter the painful stimuli. So in other words, that this treats your moderate to severe pain. The side effects are nausea and constipation. Some adverse side effects are your heart racing, if you feel like your heart is racing, and also if you notice that your breathing has drastically changed. Alrighty, if you have any of these adverse side effects, please let me know, and we will attend to you as quickly as possible. Do you have any questions? No. Do you have any allergies, Miss Smith, to any medication, seasonal allergies, food allergies? No. All right, perfect. So she has no questions, no allergies. Perfect. So now we are going to prepare the medication. So I'm going to wash my hands again. Now I am going to put on my gloves. Gloves are on. All right, perfect. So now I am going to get an alcohol pad, open it, get our medication vial. We are going to clean the medication vial from the middle into the out. All right, throw this away. So now we are letting that air dry. Now I am going to prepare my syringe and needle. So now we are going to open this 3 milliliter syringe. It is open. So now we are going to open the needle. So it's open. So now we are going to get the syringe and connect it to the needle. So make sure that is tight and it is not loose. The cap is still on. Perfect. So now we are going to draw 1.5 milliliters of air while the cap is still on. So 1.5 milliliters of air. Perfect. So now I'm going to just show you guys I don't know why it's not. 1.5. Okay. Just put that away. So 1.5. So now I am going to hold it like a dart. Take off the needle cap, place it onto the table. So now straight down into the medication vial. So straight down, 1.5. So now we are going to put the air into the medication vial. Inserted it. So now we are going to invert the medication vial. So now we are going to draw the morphine sulfate. 1.5. Perfect. Making sure that there are no air bubbles. There's no air bubbles. All right, we're going to invert it again. So now I am going to take it out, put the medication vial on the side. So now I'm going to do the 1 scoop method. So now 1 scoop method. Now I'm going to cap it, and this is 1.5. You guys can see that 1.5. Alrighty, 1.5. So now that we drew the medication, prepared it. All right, Miss Smith. So what area would you like to inject the medication into? Your deltoid. All right, perfect. So the deltoid, this would be her left deltoid. Here. So the deltoid has a chromium process, the bony area. It is very distinct. So 2 fingers down like this, and I would make a V. So this would be where her deltoid would be. So like so. That is where her deltoid muscle would be. So Miss Smith, I'm just going to inspect your deltoid, your left deltoid, just to make sure that there is no tenderness, bruising, masses, or any discolorations. Do you have any tenderness here, Miss Smith? No? All right, everything looks good. I inspected, everything's correct. So now we are going to prepare her skin with the alcohol swabs. Now we are going to clean the site, 2 fingers down right here. So this would be her deltoid just in the middle. So in the middle, we are going to do a circular motion, outer just 2 inches away. Perfect. All right, so now we're going to dispose of that. So now while we are letting it air dry, I'm going to spread the skin with my non-dominant hand like this again. And this is where her deltoid would be. Spread it tightly. So then now I would get the syringe at a 90-degree angle with my dominant hand, and I will just inject it like so. So and then I would hold the syringe barrel with my non-dominant hand, and then I will pull back just 5 seconds just to see if I am in the deltoid muscle. How can we determine that? To see if there is any blood. If there's no blood that comes into the syringe, then we know we are in the deltoid muscle. So then while I am holding it, I am going to now inject the morphine sulfate into the deltoid muscle. We are going to be doing a 10-second per 1 milliliter and then that's how we will do it. And then once everything is injected, we have to wait 10 seconds just to make sure that it has the deltoid muscle has absorb the medication. All right, perfect. So now that it is air dried, everything looks perfect. Alrighty, so now I am going to uncap the medication. And now I am going to spread with my non-dominant hand spread it tightly without touching the injection site. With my 2 fingers, all right, and then just straight down like a dart. My palm is down and my thumb and my finger is holding it like a dart. All right, perfect. 1, 2, 3, Miss Smith. All right, so now that it is in, I am going to hold the syringe barrel with my non-dominant hand. I'm going to pull back just to see if there is any blood. There's no blood. All right, perfect. So now I am going to inject the morphine sulfate 10 seconds per milliliter. Alrighty. Now that it is injected, now we have to wait 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Alrighty, perfect. So now we are going to withdraw the needle, dispose of this into the sharps container. Now we're going to get the gauze and just gently place it over the IM injection site. Now I'm going to place this in the right bin. Put the medication away. Alrighty, perfect. And all right, so it has absorbed, so we can throw this away. And then now I am going to, sometimes they need a bandage, but in this instance we don't need a bandage, and that would be it. All right, everything's right, everything's in the right container. Miss Smith, here's your call light. Now if you have any adverse side effects, please let me know and we will attend to you shortly. And that would be it. So now I'm going to take off my gloves, put it into the sharps container, wash my hand, not sharps container, into the trash, wash my hands, document my findings. Thank you so much.